Hi, my name is Warren Ringgold. I'm a medical doctor and a graduate of the University of Michigan in 1975. I'm here today to talk to you about a sensitive topic, erectile dysfunction. Approximately 50% of men who are over the age of 50 suffer from erectile dysfunction. Over the age of 60, that number gets higher, and over the age of 70, it gets even higher. Erectile dysfunction is often confused with premature ejaculation. These obviously are two different things. Premature ejaculation is a problem that is addressed in a different video. Today I'm talking about erectile dysfunction or impotence. Impotence is defined as the inability for a male to either maintain or achieve an erection when it's desired. And there are many products on the market today to improve a man's ability to achieve an erection if they're suffering from impotence. The first product was launched approximately 10 years ago. It was Viagra. It's been followed by Levitra and Cialis, all of which are similar chemicals and all of which work very well for men who suffer from impotence. The method by which these things work is kind of unique. And the unique method can produce some unusual potential side effects. One of the side effects is that with Viagra, for instance, you can see a blue haze. This is not a dangerous side effect at all. It simply means that one of the items in the retina of the eye that perceives color, actually the color blue, is stimulated by the same chemical that causes the man who's taking Viagra to become more potent. It's a phosphodiesterase unit in the cone of the eye, and also in the blood vessels that lead to the penis itself. They work through kind of a complex method of increasing nitric oxide, and this is a chemical in your blood that causes dilation of veins, and thus the penis becomes more engorged when a man takes these items. All of the drugs work relatively quickly, certainly within 2 hours from the time that a person takes them. They're to be taken on an empty stomach with no alcohol for best effects. As I spoke to earlier, there are some unusual side effects. Because it's a dilator of blood vessels, it can cause some congestion in your nose. It can cause a man to get a red face. Some men get a horrible headache with these drugs. But if they're effective, I've found that if you take a couple Tylenol before taking it, you might avoid the headache. I think the most important thing to know about the ED drugs is that all of them are contraindicated in patients who take drugs that are related to nitrates. Nitrates are like nitroglycerin that men or women would use under their tongue in case of a heart attack or chest pain. It's also given to heart attack victims in the emergency room. If you've had a heart attack, you get nitroglycerin intravenously. And some patients take nitrates on a regular basis to dilate their arterial blood vessels so that they will not experience angina. Those patients can't use Viagra, Levitra, or Cialis along with a nitrate. However, the confusion exists in that people think that these medicines cause heart attacks. The fact is that about 5% of all heart attacks occur either during intercourse or in the 15 minutes after intercourse. So if you have taken Viagra and have been able to have more vigorous intercourse, there is a chance, or if you've taken Levitra or Cialis, that a patient could have a heart attack. And if you do have a heart attack, you have to be treated differently. You can still be treated, but you have to be treated differently. You can't be given nitrates. So it's imperative that your loved one knows that you've used these erectile dysfunction medicines. It's imperative that a doctor would know if you would be unfortunate enough to suffer a heart attack. But remember this, the heart attack is not from your erectile dysfunction medicine. I hope this little tidbit helps you with your understanding of erectile dysfunction and the treatment of erectile dysfunction. Take care and have a good day.